So it'll be in the recording. So if you want to review the PowerPoint, that's how I would do it. I will post my recording for my class. All other classes, you will get a recording from your professors as well. Because it is a review class, you know, I'm okay with you not having the camera on. I know some of you might be on the phone. If you want to keep your cameras on, that's great because we can see each other and sort of bounce ideas off each other. And that really helps with studying for this. It's chapters 1 through 3, 21, 18, 19, 20, and 31. So we have about 8 chapters. What I want you to know about the exam is that there will be 5 math questions on every single exam. So I need you guys to review that, calculate with confidence. That will really help you for the math problems. So I'm going to take attendance real quickly because professors wanted to know who students joined. I see a couple of mine in there. So thanks guys for joining. And so I'll just call your name. I'll just call your name and say, I'll call your name, and if you're mine, I'll know you're mine. So just hold on a second. I just need to get my, my attendance sheet. Just to review as well, I know that some professors have been getting questions. Are these study sessions or the study guides, are they catered to the test? What I will tell you is that they are helpful for the test, but we don't believe in teaching to the test. So I know prior to this class, there was the impression that that's how we do our studying and study guide. What I'll tell you is a great deal of the information from the exam is on the study guide, but not all of it. So, but I did the PowerPoint, and how I did my PowerPoint for this review is I took it right off the study guide. So we're going to bring up certain things. I like to put pictures on there just so that, like, some people are more visual learners than auditory. So if you can remember the picture with the thing, you know, then sometimes, like, I know that helps me. Or like a little, if I'm taking a test, I'm like, what was that picture? You know, oh, that triangle, this is what it meant. So that's why I added some in with mine. So let me just pull up my PowerPoint. Any questions before we start? No? Okay, I know it's Friday night, but the reason I do study guide, study exams, study sessions, sorry, on Friday nights is so that you guys have the weekend to yourself and you study as much as you want over the weekend. Some people will have the exam Monday even, so I like to get it in before the exam, okay? And listen to the reviews. I will post my review, and I know that Professor Apple will also do one tomorrow. She's going to do more of like an NCLEX review at 11 a.m. So, but it'll help because it's topics that we're covering on the exam. Priscilla, did you have a question?
Yes. Are you going to post recordings through YouTube or through Zoom? I know some professors will do it through like a YouTube link or Zoom, or how is it going to be?
I've really disappointed my class. I know I have, because I haven't posted ours from the lecture on Tuesday, but the YouTube is a relatively new thing. And we did it last quarter as well, but it's much easier to do on the iCloud and share the link, but we can't do that anymore. So that's why we have to do it on YouTube. So I will send you guys, I promise. It just takes a while to upload on my computer. I don't know why. So, but I will do that after this session today. I will upload both our lectures and our and this exam review. Thank you for asking and reminding me that I didn't do that.
Okay, and one more thing, I'm sorry.
No, you're good.
How long is the review? Because I have to get ready for work.
Don't worry. So keep on as long as you can. I'll send you the recording. I appreciate you attending. I want you to ask any questions up front. Then Priscilla will give you that opportunity, so that anything that's like a little fuzzy for you, everybody, it'll help everybody. I'm sure of that. You know, so let's so just look over the study guide while I'm taking attendance. If there's anything that pops up for you, just let me know and we'll go over that first. Okay.
Thank you.
You're welcome. Danielle, I see you're here. Danielle, who's your teacher?
There's 2 Danielles here, but we're
Danielle
both
C.
We're both Danielle C, but we're both from teacher. It's just, her name starts with an O. I don't know how to pronounce it.
No, it's Lundy.
Oh, Wendy.
Oh, this is community. Sorry. Wrong class.
It's okay. It's all a blur. I know what it's like. It's all a blur. Okay. Adempi, I see you're on your iPhone. Who's your professor?
Professor Price.
Okay, Price, great. And then let's see. Oh, you just moved. Tiffany's iPhone. Tiffany, are you one of mine?
Yes, ma'am.
I have so many. We have 3 in our class. What's your last name?
Arvin.
Great. And then, oh, this is messing up on me. Okay, Jen, I see you. In your mind, I know that. Mona?
Yes, I'm with Professor Bogart.
What?
Mona Woolever. I put it in the chat just in case.
Bogart? I don't think Bogart's one of our choices. We have
Is
Lundy.
this community?
Yeah, we have
Oh,
Lundy. We
Lundy.
have
Maybe it's
Apple.
Lundy. Maybe it's Lundy. I'm getting peds and this.
No, you're all right.
Lundy?
Does she have dark hair?
Pardon me?
Does she have dark hair?
Yeah,
Yeah, it's Dr. Lundy.
yeah.
Okay.
She's the one that she's forensics.
Yeah. Dr.
Bogart is
Lundy.
is for Pete's.
Yeah, it's okay. Don't worry, guys. Laura,
I'm
who's-
mixing them up. I'm so
don't
sorry.
worry. Don't worry. I'm sorry. Laura, who's yours?
Dr. Lundy, I'm out of Cincinnati, Ohio, unfortunately. It's cold here.
It's cold. I'm in Colorado and it's cold here. It's
Oh, yeah.
it's oftentimes warm here, but it's not. Priscilla, I see you. Thank you. You're mine.
I'm yours, Professor.
Carol, how about you?
Dr.
Carol?
Lundy.
Dr. Lundy, okay. F-E-R-R-E-R, Lundy. Ashley Darst.
Price.
Okay, and Kimberly G.
Price.
All right, Ariel, welcome. I see you. I know you're mine, so welcome. Thanks for joining. Tamika Johnson.
Hello, Price.
Price, Bobby Huffman.
Price as well.
Great. Danielle Cook.
That was Lundy, both Danielle Cortese and
Oh,
Danielle.
right. Yes, I knew that. So sorry.
I think Cortese though had a question.
Okay, go ahead.
For Miss Apple's video, she posted one this morning, I guess. Now,
Mm, she-
that-
She'll do
No.
another one.
so which one should we watch for the exam?
Hmm,
They're the same.
let me text her. I'll text her when we're done, okay? And
Okay,
I'll ask
thanks.
her. Sure. McKenna, are you mine?
Yeah, I'm yours.
That's what I thought. David,
Professor Price.
right? J-E-W-S-K-I. Price. And then, yeah, don't worry. I got you, Mona. And then there's somebody else who's hidden down here. Oh, no, that's a Debbie. Okay, I think I took everybody. Any questions before we start? Priscilla, I was gonna divert to you and see if you have anything you wanted to talk about quickly.
Not at the moment.
All right, so we're gonna go through the PowerPoints. When I do them, I want you guys to be thinking of questions. So we'll do like kind of an open conversation about it. So I want you to think of what kind of questions might we ask, you know? Remember, we're gonna have select all that apply on the exam, and that usually, not always, but I'd say 9 out of 10 times, it's more than one answer. Okay, so just when you're reading that, say like, which are my best answers? Remember, test taking skills, you gotta know, eliminate the bad ones, pick the 2 best, and then go with your, you know, your gut if you don't know the answer. All right, let's pull up my PowerPoint. Let me share that.
I've heard of like recommendations of going through them and doing like if they're true or false. Of
You
select
won't
all
have
that
any true or
apply.
false.
No,
No true or
no, but I'm
false.
saying like as going down with them as select on the select all that apply
Mm.
on the
Oh, yeah,
answers and doing like, is this a true or false statement
yeah. That's
type
good,
of thing?
good. That's good advice.
Okay,
No, there will be no true and false. There'll be select all that applies, select best, and the math, you know, you have to fill in the number or whatever. All right, can everybody see my slideshow? It says exam 1 review. Thumbs up. Danielle, Priscilla, you're the only two I can see right now. Can you guys see it?
Yes.
Oh, good.
Sorry.
Okay, yep, no, you're good. You're good. All right, so first thing we're gonna look at is pictures here. And I put these pictures up here because the first concept we're gonna cover is about family. I need everybody to remember, so if we look at this picture, if we look at this picture, if we look at this picture, these are 3 different families. But if you ask the woman in this photo, she may say, this little guy is my family, but this is my neighbor, but he's my family. This is my neighbor, but she's my family. If you look at these 2 guys, we don't know what they are. They could be cousins, they could be brothers, they could be husbands. We don't know, right? It's whatever their definition is. And so if you, ooh, hey now. So if you look at the photo up here in the corner, that's a huge family. We don't know who's who, but that's who they include as family. Okay, so when we think about family, know that there's no right model. Each family is going to be unique. So I want you guys to tell me, you can either shout it out or put it in the chat. What are some characteristics of a healthy family?
Love
Whatever they say they
unconditional.
are.
Okay,
Quality time.
good. Quality time.
They interact and communicate with each other.
Yep, communicate.
They respect each other's boundaries and beliefs.
Mm-hmm. That, you know, that characteristic of spending time together is key. So you really want to know that they're spending time together, and that doesn't mean that they're sitting in a room together and not chatting or not talking. It's not saying that everybody has to sit around playing board games, right? You know, that doesn't happen, but whatever they think is important and a priority. So think about that in functional versus dysfunctional. When we're looking at families, we're going to think about delegation and prioritization. What do you think we mean here? Let me see.
Probably
Every person has a
families.
role.
Good, the roles in the family is
What's the
absolutely.
question?
I'm sorry, say that again.
I missed the question. I'm
So
sorry.
tell me, when I say think about delegation and prioritization, we see this down here, and that's important when we're looking at families and healthy versus unhealthy. When we're going to be delegating to families, what do we need to know? Somebody spoke about the roles. What else? We talked to my class about like teaching about insulin, giving insulin to a child. If the mom is afraid of needles herself, do you think this is going to be a good person to prioritize or delegate this skill to? So when we're doing this, we really need to do a thorough assessment of the family, the roles, the people, who's going to be around the most. So sorry, I have 2 little dogs that bark like they're protecting the house at some level, but they never would. They're 8 pounds. So sorry about that. Anyway, so I mean, we're thinking about that, right? Because those are important things to remember, that not every mother is able to do what the, you know, what another mother may do. Not every dad is able to. What if mom works at night and a child needs medication at night, you know? Are we going to be delegating to mom? Sometimes we have to delegate to adult siblings. Think about all that, okay, when we're doing this. What else? Any questions on delegation, prioritization? Any
Education levels for the parents.
great, good. Be really careful with English second language learners, right? We're going to be careful of giving them an English handout. If that's not their first language, or that's not their primary language, are they going to be able to read it? I'm a school nurse as a career right now, and I have a mom who's on a 3rd grade reading level. So I, you know, what kind of handout I'll give to her is something very different than what I would give to, you know, a parent that tells me they're in nursing school, right? So we got to be careful about that. All right, why are we not moving slide? Okay, our next slide is going to be, this is an important, very important concept I want everybody to know, and I have outlined it for you here. We're going to look at age-related concerns. So infants, when we think about infants, what do we want to think about with infants? What's our priority with them?
How they're sleeping so they don't get SIDS. They don't die of SIDS.
Good. So our risk factors for SIDS are going to be side lying position, sleeping on a soft surface, maternal smoking during pregnancy, overheating, later no prenatal care, young moms, pretermers, and male gender has the higher tendency. So I want you to know that as far as when you're looking at the infants and SIDS, all of those factors are important. Then we move on a little bit.
Why is male more a higher risk?
They just are statistically.
There's no reasoning for that?
There probably is a reasoning. To be honest with you, I don't know it, but I'm
Oh,
sure there is
okay.
a reasoning. I mean, I
Okay.
male gender, you know, they tend to sleep more soundly than female gender as babies. And I don't know if that's why they tend to sleep deeper. So, but I don't know that that's the reason for it, to be honest with you. I'll have to look it up though, now that you asked me. All right, so children, when we're looking at children, we're gonna look at playgrounds. What kind of things on a playground are we gonna look for?
Maybe soft areas, not like concrete or something safe.
Good, we're gonna look for gravel because that's softer than concrete. Good, Mona. And so we're gonna look at that, what's underneath the playground, but what else are we gonna look at when we look at that playground?
If the playground's made of wood or metal, you have to be careful if they fall. They could get hurt real
Okay.
bad if the swings, you know, are broken,
Mhm,
anything like that.
sure. We're also gonna think about,
Like,
what?
Oh, the,
Location and traffic.
yeah,
Mhm. I want you to I want you to think for a minute specifically on a playground. What piece of what equipments are gonna be dangerous for a kid? Because remember, what's the priority for a kid when we're looking at age things? What happens to school age kids usually?
They fall.
Mhm.
So monkey bars, climbing, anything.
Is
Swing.
We're gonna worry about ropes, right? Why would we worry about ropes?
Strangulation.
Mhm. Strangulation. We're gonna worry about, is it, you know, protected? Is there a fence around it, right? So that we know the kids aren't running all over. Anyone who's worked with children know that they like to run everywhere. So you want to protect them that way. Hooks are a concern. I'd focus more on ropes if I were doing that. All right, and then gun violence and safety. We talked about this in my class. I'm sure you guys talked about it too. What are some things with gun violence we need to do with children?
educate them on for kids, like if you see a gun, don't touch it kind of thing, like just report it to somebody if they see a gun, or
Lock it up.
Yeah, make sure it's
take
locked.
safety measures.
Yep, safety measures. So think about when we're teaching our families, what are we going to be teaching them?
Locking it up, safekeeping,
Yeah, you guys
they're
touched on
not
it.
within reach.
Yep. You touched on it. And I told the story in my class, and I'll just tell you, so like when you see a question like this, you'll remember it. So I had a very dear friend of mine who was a detective on a police force. He kept his gun on top of his refrigerator, loaded, unlocked. When I found that out, my daughter never slept over there again because, and I said to him, "Are you out of your mind?" And he said, "Oh, my kids know about guns. They would never touch it." And I thought, well, you know, you have to remember school age kids, that they don't have the kind of mindset that adults have. And even adults, some adults would pick up a gun and play with it, and some adults do, and they shoot themselves, you know? So think about that when you're looking at a question about gun violence and safety, that we're going to teach those, you know, teach those guns to be locked up in a safe place away from children.
I think you're supposed to have a 2 or 3 step process to even have a gun, you know.
Guns and ammo on that.
Yeah, you know what's funny is in the state of Colorado, and it's awful, but I will tell you this, you have the right to carry, which is fine. You take a class and you can carry the gun. But I have a friend whose husband's a mechanic, and he says you can't imagine the amount of car doors he opens, and there's a fully loaded gun in the door handle.
Well, it
Ready
should
to
be a
go.
2 or 3 step process.
Well, it should be, We'd like to hope it is, but
It
we all
is in,
know.
it is in Florida. You have, I mean, I have a carry permit, but you have to have a 2 or 3 step process.
All right, so at least Florida's taking care of that. I wouldn't say that much for Colorado because I don't know how much we worry about it. But anyway, that's a side note. All right, we're gonna look at tertiary prevention with chronic illness. I want you to think about children with chronic conditions. What as a parent is going to be a lot for these moms and dads?
Specialized care.
Specialized care, tell me a little bit more,
Handicap.
okay?
Like different providers and just pretty much having like all the equipment to take care of this disabled child.
Okay, now you're right on the avenue that I'm trying to get at. So remember, it's tertiary here. So we're gonna do a prevention in just a second, our primary, secondary, and tertiary. What do we remember about tertiary? What level is that for prevention?
Access to the healthcare to go to the doctor's appointments for follow-up to treat the condition.
Yeah, because it's after the fact, after having a diagnosis.
Good, so treatment is our tertiary, remember? And so these parents are gonna have lots of appointments. It's gonna be overwhelming for them. We're gonna make sure that they have them scheduled, or we as the community nurse schedule for them and make sure they're going. Because what ends up happening with these chronically ill children is they have so many things. They have therapy, they have doctor's appointments, they have equipment, they have all this, that sometimes they'll forget. And maybe that appointment is really important for the child's health. So think about that when we're dealing with parents and tertiary prevention with chronic illnesses, okay? All right, so I have a couple pictures here. So remember, when we're taking our test, we're thinking about this. We see this cute little baby, but this baby is not laying where it should be. And this looks pretty soft to me. And so this is a high risk right here, okay? We have our gun and we have it in a safe. Now let's hope the safe isn't wide open like this, but you see the safe, it's a fingerprint safe. This is the kind of things you want to look for. A lock safe, the gun is put away, it's stored somewhere safe, okay? Our playgrounds, we talked about what we're worrying about on our playgrounds, that soft stuff underneath, the ropes we're worried about, hooks, kids can catch themselves on hooks, things like that. And then our calendar, our phone, and all this is with our chronic illness, right? This is those kids, they're gonna have, the calendars are booked, the phones are busy, people are calling, did you get the equipment? Are you doing this? Okay, chronic illness on treatment of these kids. Any questions up so far? Give me a question out of these pictures you might see on the test.
I'm thinking definitely the gun safety.
So give me a question. What do you think it might say?
What is the position of a baby to prevent SIDS?
Good.
If a toddler were to see, if you had a gun in the house with a child, what precautions would you take? Could be like all that applies, select all that apply, or kind of like a case study kind of question.
Good.
Same thing with the SIDS, like that bedding, like you said, is soft. They could suffocate on it.
And as a maternal nurse, a prenatal nurse, what are we going to be thinking about teaching our moms?
Supine position, no pillows, no soft surfaces, no anything in the crib that can cause suffocation, and the stuffed animals.
No co-sleeping.
Good. And what should we let moms know? Because this is something that some moms don't know. I mean, we all know this is bad. I mean, I think the whole world knows it's bad, but people still do it all over the world. What is it that you think I'm thinking of?
Don't let them sleep with the bottle in their mouth.
They sleep with their babies.
They sleep with their babies, but what do they do while they're pregnant?
Smoking.
Oh, yeah.
I want to emphasize that. As a community nurse, we're going to teach those moms that you really cannot smoke while you're pregnant for lots of reasons, but one of them is going to be a risk for SIDS. Okay, then we look at our adolescents here. Oopsie, sorry. Our adolescents, and what do we look at with them?
Drug use, weapons,
Bullying.
Violence.
Our key on our adolescence is going to be violence. That violence can be related to weapons, can be related to drug abuse, can be related to alcohol abuse, can be related to having a relationship with, you know, someone, whether
Gang.
heterosexual or homosexual, right? Because we see violence among dating in teens because they're new to the game, right? Motor vehicle, what are we going to think about motor vehicles?
Drinking and driving.
Seat belts,
Eating.
texting.
Good, all of those. Nursing interventions, what could we maybe do to help with this violence?
Community outreach,
Okay.
the school age, like go to schools and educate teens on the dangers of violence.
Yeah, we could teach. What level of prevention is that going to be?
Encourage like activities like for them to be active, like maybe like sports.
Primary.
Yeah. Primary, somebody just said primary, good, that's primary because we're teaching, right? So we're in the first primary phase there, which is our prevention. So when we look at our prevention, this is another big one. You're going to see, give me examples of, okay, on this one. So primary, and I've given you several different examples. I'm not saying they're on the test because I tried to get as many examples as I could, but know that I want you to be able to apply to any situation. So in our primary, we're going to be preventing. So we're really trying to decrease vulnerability, reduce the risk factors. We have health promotion. Where do we see this? Healthy People 2020. We have our next one, which is going to be secondary, and that's where we're going to see screening. So we're going to screen for early diagnosis. And then we have tertiary, which is going to be our treating. And so we're going to try to restore the person to the highest level of functioning. We're going to prevent deterioration from a disease. Okay. So who are the people? These are the people with a disease. Who are the people on secondary? Undetected disease so far. And Healthy People is who? But Healthy People 2020 has a lot of primary prevention. So both of those Healthy People, I want you to think about.
I like to think about the preventions like in one scenario. So I always use like a pregnant woman. So primary prevention would be pre-conception counseling on how to lower the risk of having high blood sugar during pregnancy. Secondary prevention would be that glucose test that everybody takes when they're pregnant. And then tertiary would be the monitoring that you get if you have a result of that glucose. So it's like all in one scenario and it shows you each.
Good. I like that. Thank you. That's an excellent scenario. We're going to look at a couple other ones, but I like that one very much because pregnancy is something like you can kind of put in your head and like see the pregnant lady and say, this is what she has to do, right? Along the way. Remember on screenings with pregnancy, what other kind of screenings would we do?
Ultrasounds for like placenta previa and things like that. Genetic markers for the baby could have.
Know that when you're like 8 weeks pregnant, they do genetic testing to make sure, right? And they'll have they do a whole screening where you fill out a sheet and they say, are you, they look at your genetics, right? They look at where are you coming from? Are you Jewish and have certain carriers that you might have? Is there any cystic fibrosis in the family? This is going to flow right into something else that we're talking about. So I'm glad you brought that up, Ariel. That's a perfect example. We're going to look at a couple more and you'll see why I'm talking about this in a minute. All right. So how does this come into play when doing planning of care for children diagnosed with a chronic condition? Somebody give me a chronic condition that's out there and about there with children.
Asthma.
Autism.
Autism, asthma, anything like that. What are we going to do in our primary for asthma?
For asthma, it would be like if they live in like an area with a lot of air pollution, then you would, talk about ways to prevent them from getting exposed to it. Or if they're smoking in the house, you want
to educate about the smoke
or smoke outside.
Education.
Education about not smoking around the children and
You could
What
add,
would we do with COVID? This is just an off topic, but what would we do with an asthmatic related to COVID and our primary prevention?
keep an inhaler.
Vaccination.
You could vaccinate them or keep an inhaler, like a as needed inhaler just in case kind of thing.
Sure. Yeah, we're gonna teach those families, good. We're gonna teach those families that you're more susceptible. So you need to be really careful
Wear masks.
as a kid. Yeah, wear masks. That's all educating, right? That's what we do. When it comes to smoking in children diagnosed with chronic conditions, we just talked about this. Are different things we would do in a community. So you guys, I'm hoping you're seeing that I've talked about smoking several times. So there probably, I'm not saying there is, if I had to guess, there may be a question or two on that. Okay, so just know that when I repeat myself, focus on something that I'm saying, okay? All right, so when we look at prevention in schools, we look at primary prevention. So what do? We teach healthy lifestyle. We make sure the kids are immunized, right? We do healthy promotion activities, eating well, exercising, right? All that. When we go to secondary, we're going to be screening for health problems, okay? And we're going to care for a kid that has a broken thumb or a child that's injured on the playground. These are not going to be chronic conditions, but we're going to be screening for this and watching for this. When a kid comes in and says, my finger hurts, we're going to say, does your finger hurt all the time? Or does your finger just start hurting, right? And then on our tertiary, we're going to be doing our caring for chronic health problems, like our asthmas. We're going to be doing health referrals, and we're going to make sure that they have continuity of care. Okay. And here we go on the next one. So I did violence on this one because I think this is a, oh, hey now. I think this is a really good one to look at because everybody, unfortunately, in the community setting, we will see violence all over the place. So in our primary, we're going to try to teach anti-violence campaigns. So you know that it's not a good thing. We're going to try to prevent that violence from occurring. When we look at our secondary, we're going to say, we're going to try to prevent this happening again. So we're going to do screening programs. We're going to look at risk factors like alcohol use. We're going to refer to legal. In tertiary, we're going to treat the problem that's there. So we're going to get some mental health treatment. We're going to get mental health support. Okay, for those experiencing violence. Is this making a little sense to everyone? Okay, because I cannot emphasize enough to you. Primary, secondary, and tertiary will be on the exam.
So secondary would also be screening for like a condition, like would be treating a condition that's not considered chronic, as well as screening. It's both.
Don't get into the weeds there, but yes.
So it would be like vaccination for chickenpox.
No, that would be primary.
Primary would be the vaccination.
Yes.
Secondary would be the child's getting chickenpox. And then tertiary would be getting chickenpox and then educating the older adults on like how to prevent shingles. And then tertiary would be treating shingles, like something like that.
No, when you're saying educating, unless, I mean, so, all right, if you're educating a diabetic on, if you're educating a diabetic, then they already have something going on. So that would, you know, either be secondary or tertiary. But whenever you see educating and the client you're educating does not have something at all. So as with your shingles one, it would be your immunizations would be your primary. Your secondary would be to go to the doctor to look at a rash. And your tertiary would treat the chickenpox.
Okay.
Does that make sense?
Yeah.
So secondary means whatever the problem was, they already got it. That you were trying to prevent.
They may not have the problem yet, but they may have the problem. So it really depends on the example. So here, look back at this one. When we're looking for in our primary in schools, we're talking all about healthy, right? Because these kids are healthy. Secondary prevention, you may come across a kid that's going to have a health problem. So that's why we're going to screen and we're going to look for it so that health problem is addressed. And then we're going to care for those who are just like have a cut. You know what I mean? They have something minor, but it's not, you know, an illness, right?
Okay.
we go to tertiary, and that's where we're gonna have our chronic stuff.
Chronic is tertiary.
Yeah, so in the
Yeah.
school setting,
So is it safe to say secondary is acute?
No, I would stay away from acute and chronic. I would stay away from that totally. So maybe that's not a good one for you guys, because I feel like this one's holding you up a little
so
bit.
in the school setting, you would say like primary would be talking to children about like signs of, or like what kind of touching is okay, or what kind of discipline is okay for parents. And then secondary would be your kid has broken finger. You treat the broken finger, but you also assess to see if they're breaking bones over and over again, because it could be a sign of like abuse, which would then bring you to the tertiary stage to treat the abuse, like in a kid in a
Yeah.
school setting.
Yeah. Remember, when you're looking at the secondary prevention, you're trying to stop anything that could be happening. So for example, for diabetic screening, when you go for, I mean, if you're old enough, if you go for a well-checked visit, they're gonna draw blood on you, right? And so your primary is that when you're at the doctor's office, they teach you,
How you doing?
they teach you why you're getting screened. Can you guys mute? Somebody's unmuted, saying hi to their daughter or
Huh?
son.
Not right now, baby.
Gabriel.
I gotta work.
Ariel?
Sorry about that.
Okay. Well,
Professor, can I ask a question?
yeah, go ahead.
Okay, there's been so much confusion a while ago with that secondary and tertiary, but I'm trying to figure it out. Secondary, it says screening. So, as a nurse working in the clinic, I'm not at the stage of primary. I'm more at secondary because I'm looking at a client coming towards me. His eyes are red, and I'm assessing him just by looking at him. So now I'm entering into secondary prevention because I'm going to do screening to see if he has high blood pressure. That those red eyes could be a sign of high blood pressure, or could it be allergies? Am I
Or
on the
could be
right-
pink eye, or could be anything, yeah.
anything? So it's more like, okay, I want to assess this patient because something is happening and I need to know what this is. So right there, I'm screening this patient to see what's going on. Am I on the right track with secondary here?
You're on the right track, but the thing with you working in a clinic, you do a lot of primary prevention beforehand. So you're going to be doing,
Yeah.
as those clients come in, you check their blood pressure. They should be normal, right? But then when you get one with high blood pressure, then you're going to screen and see what's going on. Why is there high blood pressure? Is there something going on? Are you nervous today? Or is it that this is something we need to worry about, right?
Okay.
And then you get to tertiary where you say, oh no, this is high blood pressure. Here's your pills.
Okay, got it. It's clear.
Make sense?
Yeah.
So
Yeah.
when you look at the prevention, it's easier not to look at it as like steps, because the way that I see you explaining it, it's that the process is like, it's fluid, it's interchangeable. Like you don't go straight from primary to secondary to tertiary every time. You can like if you have a patient who has high blood pressure and you're treating them for high blood pressure, primary prevention could play into ensuring that their high blood pressure doesn't turn into like a cardiovascular disease.
No. So primary prevention is going to be somebody that's healthy. So if they have high blood pressure, you can't go backwards, so for the diabetic teaching, although it's teaching, they already have a problem. Why are we teaching them about blood sugar control?
Because they're diabetic. So it would automatically be secondary because you're screening them to prevent complications. Okay, so primary is like you've never had any sort of chronic condition. You don't have any at all, because if you have one chronic condition, even though you're not educating for that condition, you're educating for a complication of that condition, it's still considered secondary.
No. So if you have a diabetic patient and you're teaching about glucose monitoring, you're screening them for high blood pressure when they walk in the door. So there's your, you're screening for the, so your primary would be teaching them, let me think about this, teaching them about the
Prevention.
poor air quality after wildfires, even though they have diabetes.
Something that has nothing to do with their condition.
Yeah, but if they have a chronic condition, then what you're trying to do is prevent these things along the way. Ariel, and I appreciate you saying that because it's not a spectrum. It's not like you go primary, secondary, tertiary. And I'm sorry if I'm explaining it that way. Primary is always our goal. We want to keep everybody healthy as a community nurse. So that's what we're always trying to do. But sometimes we can't do primary because we already have to screen them because they're at risk for something.
Okay,
Right?
that was a scenario, the blood pressure situation, but I understand.
Yeah, so I mean, we'll look at this again. I'll come back to this, but we're gonna move forward because I feel like the more I talk about it, the more confusion.
Base the intervention, basically. Like you want to look at.
Yeah, but you have to be careful with this because I think you're looking too far into it. It's like on the surface, like what can I do as a nurse to prevent illness across the community? So that could be in any setting. What could you do?
Okay, so the questions are going to be more straightforward than
this is an example of secondary prevention, A, B, C, D.
Okay.
Okay. We're going to move on to public health. So remember, our primary goal of public health is to prevent disease and disability. And remember, when we're trying to prevent, that's going to be our primary, right? We're going to try to prevent it. So how do we do it? Keep people healthy. We have a population focused practice. We work to understand the problems of a defined population, thus aggregates, families, individuals. Clinical practice nurse focus on the treatment of individuals. Okay. Our public health policies, they create health standards. Leading cause of mortality we have seen in public health is going to be decreased mortality related to communicable diseases, and the increase in the number of older adults and increasing population is a problem because we're getting more older people because of the baby boomers, right? It's a huge group of people and now they're getting older. And so now we have these challenges because we have the increased population. We know the world is increasing because of fertility rates are up, decreasing in mortality, living longer, vaccinations, screenings, medications, right? Any questions on that one? This is pretty much like data. I need you to know the data on this. So primary goal is going to be our prevention of anything. Population focused practice, but we are going to treat individuals. Leading cause of mortality is chronic diseases. We know that the increase of older adults, baby boomers, going to be a challenge for us as public health nurses, and the population of the world is increasing. It's increasing because we have all these things. Yes. This is data. Just know this data. Right. So when I did this picture, I want you to think about public health as like a huge combination of everything. We worry about obesity. We worry about vaccines. We worry, is the water healthy? We worry about who's in leadership. What are we doing to prevent? Who's in our family? What kind of data do we have? How about our occupational health? How about healthcare, birth defects, bioterrorism, violence management, emergency preparedness? All of this is going to involve public health. I like this one as well. Health, lifestyle, family history. Do they rest? Where's their environment? How are they eating? How are they sleeping? How are they cleaning? Do they have any relationships? What kind of stress do they have in their lives? Are they exercising? It's just a spectrum. Any questions on that? Know that public health is on a big spectrum like that. So there's tons of things that are feeding it. Okay. It's not just the wellness of our patient as far as med surg wellness. Okay.
A quick question, Professor.
Yeah.
I'm looking at the review here and you got, and I'm wondering if we will be seeing any question directly on Healthy People 2020.
You will.
Okay.
All right, we're going to move forward on this. And what I want you to know is about patient rights. Very important here. This goes med surgery, so you guys should know this, okay? But remember, unless a patient is incompetent, that patient should have the right to self-determination, which means they can pay their own bills or manage their own finances. Where we see this violated a lot is where?
The elderly.
Yep. So when we look at screening or abuse, what's a question as a community nurse we're going to ask an older person?
If they feel safe at home with their caregivers.
Okay.
Where do they get their like food and like who shops for them and stuff?
What else are we going to ask them?
Who handles their finances?
How do you pay your bills? What are we going to be alarmed if they say?
If they demonstrate like a lack of control over any of those, like if they say, oh, I don't know, my son has all my cards, or I don't know, my son buys all my food, something that would indicate they don't have any say in their situation.
Good. I want you to think about with our abuse with children, it's there. You're not going to see financial so much, but we're going to watch for abuse all along the spectrum, but really emphasize abuse on the elderly. So appropriate goals for this, for our group of elderly, we're going to make sure we're maximizing their self-care capacity so they can take care of themselves. We're helping them manage their chronic diseases. We're helping to prevent complications, achieving the highest possible quality of life, and making sure that they have comfort, peace, and dignity. Okay. Now, when I read this, I want you guys to think with a nursing mindset. We are there to promote the wellness and health of our patients, right? So if they're old or they're young, or it doesn't matter, we need to help them self-care. We need to help them manage their chronic illnesses, right? We want to prevent complications for them. We want to delay deterioration, particularly in the older clients, but you know, this can apply anywhere in nursing. Primary focus, these are two words that were in our first chapter we read, and I do want you to know both of them. Community-based nursing is going to be on the care of the ill and families across lifespan, and community-oriented is on the health care, so the healthier. Okay, so our community-based is going to be focusing on our sicker clients, and our community-oriented is going to be the healthier ones. So we want to, as a community-oriented nurse focusing on the healthy, we want to see where are our risk factors and how do they play in. Should somebody throw out a question that might be on this?
A nurse is implementing a program to prevent smoking in school-age children. Is this an example of community-based nursing action or a community-oriented nursing action? Okay,
you're gonna not yes, but what I want to tell you is you're gonna look at community-oriented more as like evaluating what risks do we have. So maybe on that one, you might be teaching to a group of kids, let me think about this, a group of kids that parents smoke. Because then we're evaluating the risk of those specific individuals, okay? Any other questions out of these three? Somebody give me one. How about which of the following are we worrying about with the care of an elder client? A, abuse, B, where they live, C, their clothing, or D, alcohol use?
Abuse.
Yep. It won't be that easy, but that's along the right page, okay? All right, then we talked a lot about school nursing. Well, not a lot in my class because we only talked 10 minutes because I told them that we would talk about it through the whole quarter. But we want to look at the role of the school nurse as we look at the whole school, we look at the community, and we look at the child. So I like this picture here. it gives us like a feeling of all this. So this is what we're going to do as school nurses, and this is what I do all the time. I educate those kids on healthy things. I make sure that the community is involved. I make sure that I call the family and what's going on with the family. I do a lot of family assessments in my career. Employee wellness, I talk endlessly to teachers about all kinds of things. And half the time I say, don't ask me, go to your PCP, because I don't want to tell them what I think. So physical environment, like, is the school safe? What's the playground look like? Stuff like that. Social and emotional is huge in schools. Counseling and social services. Health services, nutrition. I told my class, I think, so I go into the cafeteria and I've actually tried to change it because it's free lunch for all students in the district that I work in. But, you know, they serve kids like cinnamon buns for breakfast. And I'm like, whoa, we're giving free food to kids and we're giving them sugar-filled, fattening cinnamon buns. Like, what is the point of this? Why can't we give them cereal and milk? I mean, not that that's great because there's not a lot of protein there, but I think a box of Cheerios is way better than the big cinnamon bun that they're about to eat, for lots of reasons, for cholesterol, for weight management, for that. We worry about obesity among children. That's one of our primary focuses with children. So it's really important, their nutrition and environmental. So here we go back to our preventions, okay? And I use it in schools again. So we're going to do primary, we're going to educate those parents about healthy nutrition choices. And we worry about with children, this is our one of our primary worries is obesity. Right? What do we worry about with women? Anybody remember?
Are we looking at any specific one of these or in
Nope.
general?
Nope, just in general. It's just a review question. What do we worry about with women?
Pregnancy?
Sure, pregnancy, but I mean,
Breast cancer?
we screen for that, yeah.
Are you talking like
Intimate
school?
partner abuse?
No, not in schools. This is off topic of schools. I'm just reviewing it with you guys.
Intimate partner.
Because we don't have women in schools usually. We have kids in school, right?
Was it an eating disorder?
Yep. Who said that?
Me,
Good work, me. Who's me?
Tiffany.
Good work, Tiffany. Somebody listened in our class.
Yeah, it was bulimia, I think. Wasn't it bulimia?
No, it's just eating disorders and their diet, because women of adult women, I mean, I can tell you, I haven't met one woman who thinks that they look fantastic in the mirror. So we have to worry about that with women, and women will take extreme measures. I mean, if you ask plastic surgeons how many women come to their practice versus how many men, it's amazing. So think about that when we're looking at women. But that was off topic because I forgot I wanted to talk about that. So that was just off topic. Anyway, secondary prevention on our schools. We're going to screen teens for obesity with a body mass greater than or equal to 30. I will tell you, we screen all children up until this year. We now no longer do BMIs. People were too upset about it, but we are going to screen those teens for obesity because we're going to try to prevent, type 2 diabetes among our 15 and 16-year-olds. We're going to analyze children's weight and growth as part of the health assessment. In tertiary, we're going to work to, and this is what I was just talking about, improve the quality of food in school lunches and breakfasts. We're going to help communities establish local farm to school networks, and I cut off the end, but okay, so these are going to be our 3 levels here. Does this make sense for school? I feel like school's a good one to use as an example because we can do a lot of it in schools. And then we'll tell you on your test, you're going to see prevention in schools. All righty. Somebody asked me about Healthy People 2020. I need you to know Healthy People 2020. These are boxes in your reading. We're going to look at schools. We're going to make sure that we are reducing the number of school days for those kids with asthma, because a lot of kids will stay home with asthma for no reason. They're not even being treated and they're not having a flare up, but the parents just keep them home because they're afraid they will, or they had one over the weekend or whatever. So we're trying to reduce that number. We're trying to increase vaccine coverage. We're trying to look at The proportion of nurse to student ratios, 1:750 is what Healthy People 2020 wanted. I can tell you in the state of Colorado, I am the only district that has one school nurse in the building, in every building. Every other one they share. So you have one school nurse for 3 to 4 schools. So it's really very different than, I grew up on the East, and in New Jersey, every school had a nurse, but out here, that is just not the case. So we're trying to increase those numbers, okay? We're gonna do health education for our drug use, suicide, tobacco use, STDs, dietary, physical activity. Okay.
I have a question.
Yep.
About that slide.
Yeah.
If like all those, like each point, is that like not like a law, but you know, like we need to know those numbers, like the IVP 27?
No.
Is there a list of those that we need to know, or these are just kind of like,
This is straight out of your book.
so this is like each one of those points, though, we should know kind of thing, like, or is there more?
So listen to what I said about them. I tried to emphasize the ones I thought were important,
Okay.
if that helps. I'm not saying you need to memorize this. What I want you to do is be very comfortable with what we're looking for in schools. So remember, our key things are going to be reducing number of school days missed. We're going to look at vaccine coverage and health education. Is that helpful, Danielle?
Yeah, thanks.
Okay. All right, then we're gonna go to our genomes and our eco maps. In my class, we didn't spend a whole lot of time in this, but I will tell you, I do want you to know this. So a family crisis, we need to know what a family crisis is. It's when the family is not able to cope with an event and becomes disorganized or dysfunctional. What might we see with a family crisis? What kind of comment might a client say that tells us they're in crisis?
They lost their job.
Someone died.
Okay, so they lost their job would be no, because you can lose your job and be able to function. What would they have to say
Having
in
chronic
addition to
Death in
lose
disease.
the
their job?
family?
Like being diagnosed with cancer, having chronic disease or something like that.
But
Death
some
in the
people can
family.
handle that. So what would they have to say to you that would be a flag that they're in crisis?
I don't know how
Can't
I'm
take
gonna
it
do this.
anymore.
Yeah, I don't know what I'm gonna do. How am I gonna handle this?
Like
Right?
the husband
How
died,
about
he's
I
the
can't
breadwinner.
handle this? I can't,
Yeah.
because
Scared
then
to
that's
go
telling you,
home.
right? I can't handle this, right? I lost my job, I can't do it. That kind of thing,
Yeah.
right?
They're
These
scared
aren't gonna be,
to
so
be
a family
home.
crisis for you and a family crisis for me and a family crisis for Carol and Tamika and Tiffany might all be very different. Because what one family can handle, another family can't. Isn't that true? Have we seen this? Yes.
Yes.
Okay. Genomes, the way I want you to remember this is G for G. So genomes are going to be genetic makeup. What's happening with our genetic makeup? So what I have for you is a picture of a genogram. Okay, when we look at our genes, we're going to be looking at, hey, what's been going on in the family? What is popping up and where is it popping up genetically? So we all know the conditions that are going to have some genetic component to them, right? Heart disease is one, diabetes is one, genetic markers is one, blood pressure is one, high cholesterol is one. We should know all these from MedSurg, genetic driven. Okay, obesity. Miscarriage is an interesting one because that can be genetic, but it cannot be. What might we do though if we know that there's a history of a miscarriage among a family?
Monitor pregnancies closely.
Yep. You're gonna do more ultrasounds, you're gonna do more screenings, right? You're gonna check the blood flow to the placenta. Right? Okay, so this is our genogram, G for genes. And then we have EcoMaps and E for E. It's going to be, E is our environment. It's like what's going on in our world. We have this family, but then what does the family do? They go to work, they have friends there. They go to college, they have family therapy, they have a school, they have friends, extended family, basketball, health services, like, so it's all the things that they do and how they're connected socially. So the way I like to remember it is E for EcoMap environment, because it's really what's going on in the environment. Okay, and the organization with other groups. Any questions on those two concepts? I do want you to know them. Okay. We're going to flow into home visits. Why do we think home visits are the best assessment?
People are more comfortable at home.
You can see what's going on in their home when you go in there, like how they're living and, you know, basically what's going on.
Yep.
There are more members of the family to assess and to speak to.
Mm-hmm.
It's more relaxed, so they feel like more comfortable sharing more.
They can. And remember, home is something that's valuable for everybody. Your home is very special to whomever you are. The way my home is run and what I like in my home, you may not have and you may not understand, but you're the nurse going in there. You put all those biases behind you and you move forward, right? Make sure your assessment is interactive. Because remember, as we're evaluating the families, those families are watching us. Okay. You don't want to have too much disclosure, because the family may say, well, why is she asking me so many questions? And why do you care about this, right? So we want to be very therapeutic in our communication on home visits. What's something that we worry about as nurses going to the home?
Disease,
surrounding,
catching something, bring something home.
Language barriers.
Absolutely. So as nurses, we go in there, all those answers are correct. So sorry, guys, for the dogs. See, they think they're ready to, I don't know, attack someone, but who knows who. All right, so we're gonna look at that. And when we do that, we're gonna look at what are we gonna do as a nurse to keep ourselves safe. And what we're going to do is,
keep your phone on you.
Yeah. We're gonna leave a schedule at the office. We're gonna try to go during safe times of the day. So that means more like 10 to 2 as opposed to 7:30 at night, right? We're gonna dress appropriately. We're not gonna wear half shirts. We're not gonna bring a whole bunch of money. We're not gonna have our, engagement ring that we just got that's 6 carats on our finger. I mean, I hope somebody's got a 6-carat ring in nursing school. I'd love to see it, but we're not gonna wear our expensive watch. We're not gonna wear, those kind of things. Like an iWatch I might wear because that gives you a safety, but that's not something that I would show and put my wrist up and say, hey, look what I got, right? Avoid secluded places, sorry. Obtain an escort. We talked about this in class. You can get an escort. Be careful though about our violation of HIPAA with that. We're not going to bring a friend with us. Sit between the client and the exit. If you feel unsafe, your job is to leave. And check in at the end of the day so that your agency knows you're safe. Okay. So what might be a question on this one?
Select all, apply. How do you keep safe in home care?
Beautiful. Beautiful. So I want you to know that. I want you to know all of that. Okay. Alrighty. Then this is important-ish. So on your study guide, and I will tell you, there's going to be some, like maybe 1 or 2, maybe, on the different phases of when you're in the home. And this takes us almost to the end of our PowerPoint, just in case anybody's wondering how much more time. So we have initiation, where we look at why are we going? What are we going to share the information and the purpose for the home visit. So we're gonna say, hi, I'm such and such, and I came here because your doctor referred me to come as a follow-up after surgery to make sure you're functioning and everything's going along, and those kind of things. That's what we do as a initiation. We're gonna do a pre-visit. We're gonna call them. We're gonna say, are you okay if I come? We're gonna make sure that they schedule the visit and then review what we're doing before we get there. Now we're here. We're gonna say, hi, I'm so such and such, and and this is why I'm here. And we're gonna say, how'd you do today? What have you been up to? Those kind of things. We're gonna have a nice rapport with them. We're gonna establish that nurse-client relationship because this is gonna be key, as it is with every nursing encounter. And we're gonna do our assessment, evaluation, all that stuff, okay? And then we're gonna terminate at the end, review the visit, and plan for future visits.
Can you go back to the
Yep.
in-house real quick?
Yeah.
Sorry.
This one?
Yeah.
Yeah, okay. So
Thank
you're
you.
gonna, so I want you to think about when you're studying, like, I don't want you to memorize this stuff, guys. I want you to think in your head. When I'm in the home, what am I gonna do? I'm gonna be social. I'm gonna establish my relationship, I'm gonna do my assessments. I'm gonna do, all the things I need to do. Okay, and then like your pre-visit, think to yourself, what am I gonna do? Well, I gotta figure out why I'm going. I have to schedule it, right? And then in our initiation, we're gonna say, why are we doing this and what's the purpose? And then, we can get into the start of that relationship. Is that good, Danielle?
Yeah, thank you. You just went so quick. I couldn't.
I'm sorry.
You're good.
And then termination, we're gonna go over the visit with the family, and then we're gonna say, do we need to do anything else? And then when we're done, we're gonna record the visit and plan for the next one if we need one. Good. Oh, I forgot about vulnerable. So sorry, we got a couple more. All right, vulnerable populations is a concept that you need to know as well. Our vulnerable populations are going to be our homeless, our mentally ill, our substance users, our veterans, and our migrant workers. They have several risks that are going to make them more likely to develop disease. They have an increased risk of developing adverse health outcomes. Know that poverty is going to be our primary cause of vulnerability, and it's a problem as we speak. So the factors we think about with these people are poverty, unemployment, poor education, right? So here's my pictures for you. Those people working out there, what do you think they're going to be? What are they going to be very susceptible to? This is going to be in our next chapter that we do. It's like a preview for it.
Sun damage.
Sun damage, yep. What do you think is going to fly overhead here?
Whatever they're treating in their crops.
So they're getting fumes and stuff like that.
Yep, absolutely. They're going to be exposed to all those pesticides. And I will tell you, I don't think they give them a heads up and say, hey, it's coming. Then our homeless, we think about these people, and how they live. Our veterans, we know why they're vulnerable. They've the stress, the trauma, all that they've been through. Any questions on vulnerable? All right, so here we go back to our prevention. Our primary is going to be, let's give flu vaccines to those people who are immunocompromised. Okay. Or give influenza vaccines to the whole group of them, because they're going to be very susceptible. So think about secondary, we're going to be screening clinics. So for example, if you're a nurse and you're in that homeless shelter, you have a high risk of TB. We see that the biggest place we see this is prisons. So what are we going to do? We're going to screen for TB. I bet every single person, every one of you has been screened for TB at this point along the way. And you don't even have to work in a prison.
Probably 1,000 times along the way.
And you will for every job you get in the healthcare facility.
Yeah,
even though we're not, well, I don't know who's vulnerable. I shouldn't say that. Any of us could be, right? So but we don't have to be working in the prison to get screened. What are we going to do? We're going to conduct a therapy group with residents of a group home for severely mentally ill adults. So look at our tertiary, we're treating them. Any questions on that? Just another example. We looked at our acts with public health. I want you to know both of these. FEMLA, or the Family and Medical Leave Act, We know that that's going to protect us, protect jobs and health benefits where we need. Someone needs to care for their sick child, sick parent, sick whatever. This was passed in 1993, and it will help take that stress out of caring for an ill family member. American Disabilities Act is exactly what it says. It protects people with disabilities against discrimination. These are two of those things that I would just know the definitions of. I think that's it. Oh, one more. Advocacy and social injustice. What's our difference? Advocacy is when we as nurses are going to be advocates. We're going to go for helping to do policies that are going to help our vulnerable population. Social justice is really justice to all. So we advocate for our patients, we speak on their behalf, we try to get them health services, we try to help them, we try to make appointments for them, we're advocating for them. And our social justice means that we look at who is getting treated fairly with those that are advantaged and those are disadvantaged. This is one of those definition thingies that I want you to know. All right, that I promise is the last slide, I think. No, it is. Yeah, that's what I thought. Okay, so, oops. So we went over all of that. I can, if you guys want, and it's up to you, you can leave at any time, so don't feel obligated. But I have 2 Kahoots that are like good reviews of the 2 weeks that we've covered. If you guys want to do them, I'm happy to do them with you. If you're over it and you're tired of listening to my voice, because I'm certainly tired of hearing my voice, then you can sign off. But I just want to offer it to you because it's a good way to look at questions that might apply what we've talked about. Want to do those? One of the Kahoots I did with my class already, but the first Kahoot, we have to do it together. I don't know why. It won't let you guys do it. So what I want you to do is on a piece of paper, or on the chat, you can put what color. So we'll do red is R, green is G, blue is B, and what's the other color? I think yellow, Y. Okay, on our Kahoot. All right, so let's take a look at that real quick.
We have access to these Kahoots, like when we're not doing them with you.
I don't. That's a question that I would say probably not because I have a problem sharing them with you, but I don't know if we're allowed.
I know Professor Price does Kahoots with us, and then she posts the Kahoots.
She'll post the link.
Yeah.
Let me touch base with Dr. Lundy before I do that, okay?
Dr. Lundy does them too.
She posts them?
Yes, she lets us review with them.
All right. Well, I'll text them, and if that's the case, then my class, I'll send them to you. Because the other classes have it, right? So sorry,
No, could you send us the one that you're gonna do now, if you do?
So if you've done them in your class.
Could you send it in the announcement so all of us could gain access to it?
Yes.
Okay. Like I said, I just gotta check with the boss. So it's actually Dr. Brown who I have to email about it. Let me see.
Why did I think it was Dr. Lundy, the head of the community health program?
She's the head of community health. Dr. Brown is the head of online nursing.
Oh, okay, got it.
Yeah, so they're both my boss. Well, you know, Dr. Lundy's my colleague. Her and I work very closely together.
I have a question about the study guide.
Yep.
So when you, the question, review concepts regarding assessment and how health disparities play a role in ADPI and health prognosis. I was unclear on that. Can you specify for me?
So that's going to be your health determinants. What do we look at when we're, who's going to be more how is our health determined? So like, let me think of a good example for this one. Our environment, what we eat, if economics, all those things that are health determinants. Do you remember going over that in class?
Yeah.
Sorry,
yeah,
I'm just
yeah.
trying to find that Kahoot. That's what she's talking about. That's what we're talking about. I can't find this one. Where is this silly thing? Okay, here we go. All right. Here's our first one, and this is the one that I don't know why. I see some people are on there. Look at that. Okay, so I'll just enter name review for us. Okay, ready? Here we go.
It looked better, and you fixed some of the stuff that so I think so far. I'll probably get better with it.
Why are nurses increasingly providing care in homes rather than hospitals? Hold on, because I can't move us. Why can't I move us? There we go. Oops. All right, so our answer there is, sorry guys, I have all this on my screen. It's taking up the whole thing. So why are we going to be doing homes rather than hospitals? Because we're going to do the individualized. Home care is expensive. It's more efficient to give care in the home. People prefer not to receive care in the home. So we're going to be looking at prefer to give home care with individualized attention. Okay, here comes our second one. Multi-select. Oh, come on. Sorry, guys. We're like in the middle of, okay. Which of the following actions describe effective public health nursing practice in the community? Partnerships are established, epidemiology investigations, new services are organized, and staff members at the public health agency continue to increase in number. I picked the, well, I'll show you in a minute, but I just picked one so that it wouldn't yell at me. All right, so I picked the wrong one on purpose. So our epidemiological investigations we're going to be looking at, that's important when we look at public health nursing in the community. We're going to make sure our services are organized where a particular vulnerable. Why would partnerships established with community coalitions not be one? Remember public health nursing practice? What did we talk about? What's our goal?
To make sure everyone is pretty much healthy.
All right, we're trying to decrease, remember? Decrease our chronic illnesses and keep people healthy. So partnerships with community coalitions is not going to keep our clients healthy, is it? Not necessarily, but our epidemiological investigations are, we're going to look at our environment. That's going to help keep them healthy, and new services for vulnerable populations, because we know they are vulnerable. They're more likely to get sick. Which of the variables have led to a stronger commitment to population-focused services? Economic turmoil, emphasis on overall health care, emergence of new drug-resistant diseases, or threats of bioterrorism? I'll just pick green every time so that it doesn't yell at me. Okay, so we have 3 here. Following variables that are population focused, remember we're looking at the group as a whole, population focused, we're trying to improve for everybody. So would economic turmoil and demand for high-tech care help everybody? No. So emphasis on healthcare rather than only on acute care, yes, because we're trying to do the whole population. Emergence of new or drug-resistant infectious diseases, yes, is going to make sure that we're looking at the population. Think about COVID there. And bioterrorism is another one that we're going to worry about our populations. Which of the following actions best represents public health nursing? Assessing the effectiveness of the high school clinic, providing care to children, caring for clients in the home, following their outpatient, administering follow-up care for pediatrics. Remember, public health nursing, what is our goal?
Red.
Good. Why'd you pick red?
Because you're looking at the overall, like the overall school, the overall community of the school, I guess.
Yeah, we're doing public health. We're trying to decrease problems. High school clinic is going to be a great place to do that. Okay. Caring for somebody following surgery. No, that's not going to decrease diseases. Administer follow-up for pediatrics and an outpatient clinic. It's already a problem there, right? And then providing care to children and their families at the school clinic is another one that, oh, not going to work. Okay. Which of the following best describes community-oriented nursing? Remember, it's community-oriented or community-based.
Okay. Well, that's good. Okay. So then,
All right, community-oriented. Somebody tell me what they know about it.
Community oriented is focused on health promotion and prevention of the overall community setting.
Jen, what were you gonna say?
I was gonna say they're like healthy people. They don't have chronic diseases.
And so right here is the word health, right? Health promotion, disease prevention. We're looking at healthy with oriented. How did Florence? No, we didn't talk about this, but I wish I could skip. I mean, not skip it. She's very important, Florence Nightingale. But how did she bring it? Help? She focused
blue and
on the
green.
soldiers, kept careful records, interacted with each person assessing, and she helped women volunteer.
Blue and green.
Very good, blue and green. Who picked that?
Ashley.
Good job. Why'd you pick blue and green?
We reviewed Florence Nightingale
Oh, you
in
did?
class. Yeah.
So she was all about environmental. She's the one really who started community-based nursing, and it was called environmental. She was all about the environment, because the environment she was in, it was like pretty gross, and she figured out that if you change the environment, how much better that will be for the patient. So here we're focusing on the environment, and she kept records so that we knew what we could improve for our patients.
There was another one as well about the cadet nursing or something like that after World War II, right?
Yeah. I wouldn't worry too much about the history though. I mean, it's, one of those nice to know things. Which of the following nurses is famous for creating public health nursing in the US? Oh, I think you just, you just alluded to this.
Yeah.
Sorry. All right, so we had her, but public health nursing was really Lillian Wald, and that was back in our history about public health with her. All right, we're gonna do one more in this Kahoot, and then we'll go to the other one. Let me just ask while we're doing this. I don't want to go over this one, so let it just run, and then we'll skip it. This one, I forgot there was a lot of history on this one. All right, I'm gonna stop this Kahoot. All right, let's look at our other one. It doesn't have so much. Alrighty,
Do you think
I'll sh-
history is gonna be a big part of the test? I know
who's asking me that? Oh, Danielle.
Ashley,
So I'm-
sorry.
Oh, Ashley, so I'm not focusing on history for a reason.
Okay.
So it may be on the test. I can't say it won't be, but I wouldn't spend a whole lot of time committing to memory all of.
Okay.
Okay. My eyes look like they're crossing on this computer. Sorry, that's scary looking. Okay. Let me see. I'm just texting Dr. Lundy, so let me just see what she says about the kids. Okay, we're gonna do the second one. Let me pull that up. This one for my class, you guys did it already, but let me just see. Mhm. They emailed it to my, hold on one second, guys. You guys can't see my screen, right?
No.
Okay. Mhm. So
I
sorry.
do have a
I'm listening.
question over the study guide.
Yeah, go ahead.
So I know a lot of, I like to go through the study guide and write it out and everything. And I noticed that a lot of these bulletin points are more just statements than they are of going into the book and finding the answers, besides like a couple of them have like obviously review the tables. My question is this your study guides? I know that you already said that not like there's a lot on it that's going to be on the exam, but not everything is on the study guide for the exam. My
Mhm.
question then is, are we like just, how can I put this? So I had a teacher once who said that her study guides are for us to look at what the specific trees and not the entire forest. Am I supposed to be assuming that this study guide is like what we should really just be focusing on and only focus on the study guide? Or do I need to go into the book and review these tables? Or am I just going in?
Okay, so if the tables are on the study guide, I want you to review them. Does that make sense?
Correct.
Okay, if the tables are just tables that you think, oh, maybe this would be nice to look at, I wouldn't do that. I'd look at Healthy People 2020 throughout all the chapters. That's a big one.
Okay.
Does that make
And then
sense?
this, yeah, and then like for the statements that are put out there that you've gone over, like obviously like the definitions are already put on some of them. So are we just to know just the definitions of them, of those?
Give me an example.
Like advocacy and social justice, like it says know the difference between those. Are we just supposed to, is that going to be like a definition based question, or is it going to be more of like an example question of what the nurse is doing type thing, if that makes sense?
Well, I can't really tell you what the question will be, but if it's saying know the difference, what do you think that means?
To me, that's a definition based.
I'd go with your gut. I'm not promising that, but if you know the difference, you could, if you know the definition, you'll be able to apply it to anything, right?
Okay. Yeah,
Does
so
that make sense?
yeah, so really then like you just, it's just in the study guide, it seems like it's a lot of statements compared to us looking up the information ourselves, if that makes sense for what I'm trying to.
I'm sorry, say that again.
So like the study guide itself looks like it's a lot of statements alone on the bulletins. Like assessment is interactive as the nurse evaluating families. They are evaluating the nurse. My thing is your guys' study guides have more statements than us going into the book and looking up our own answers to the study guide. So should we
So
just
tell me in your
focus-
other classes, you get statements and you have to go into the book and find the answers?
Pretty much, yeah.
No. What's on the study guide is what we want you to primarily focus on. So we give you the information. But when we
Okay.
say, look at Healthy People 2020, that means go look at Healthy People 2020.
Can I make a comment, Professor?
Sure.
I understand what she's saying because I was like that, but when I
Yeah.
was like that, I was wasting a lot of my time. Because
Yeah.
when I used to get PowerPoint and review documents like this, I still used to go back to the book because I wasn't sure if I should just go with what we get on the resource that you guys give. And I used to like waste a lot of time and sometimes fail my exam until a student pulled me aside, explained to me, no, whatever you see on the study guide, just go with that. The professors know what they're doing and they know what they're giving you. Just go with that. If you want to confirm the topics or whatever is said on the study guide with your book, that's okay, but don't do anything extra. And to be honest with you, I'm in my second to last semester because of another student who pulled me aside and explained to me, don't do anything extra like what that student is asking. Don't do all of that. Just focus on what is on the study guide. That's it. And I made it this far.
Okay, so I have to tell you as a professor, I cannot tell you only study the study guide ethically. I cannot do that, right? That would go against everything as a teacher could do, because we believe everything we teach you is important, right? We believe the textbook is
Yeah,
important.
what I did was like you do this recording with us. I use my
Mhm.
study guide that you guys
Mhm.
send us and the PowerPoint, and I go over my recording. For example, last semester I did 2 classes. I did maternity and I did med-surg 1. And I used the study guide, all the PowerPoints and the recordings. And I did confirm some things in the book because I mean, you still have to go to the book, but I didn't go outside of the ambit of what was given to me. And I scored 99.99 on maternity HESI, 99.99 on med-surg 1 HESI. And that was because I followed the document that you guys gave. I researched, I looked back in the book to, to read up a little more because I wanted understanding of what was said on the PowerPoint and the review guides. And then I sit my essay and that was my end result. I read, but I didn't do anything extra and waste my time.
I think
Okay.
that the point of
That's her opinion. Guys, I can't get into it with you guys because I really can't. So if you give each other advice, then listen to the advice if you want to. You know what I mean? I can only tell you, I need you to study. I've gone over with you almost everything on the study guide. There's a reason I'm spending that time doing that. And it's not because I have nothing else to do on a Friday evening.
No, I understand. I just want the other student who is asking to understand that other students do, things a certain way. Just like someone tell me, I'm trying to tell her that this is another way that we study. And I mean, whatever is good for her is good for her. Whatever she, if she wants. I just wanted the other student to hear that.
you need to know the information that's in your book because this is your career. So read the book when you're assigned the chapters every week and study that when you're being assigned the chapters every week.
Right.
But if you're looking to pass the exam, then use the resources that the instructors are giving you just for the exam. But use your book for the knowledge that you need for the class success, for the assignments and everything else.
What I will tell you is that tonight I did not cover every single point on the study guide, but I can tell you I covered about 98% of it.
Right, and I appreciate that. My main question was just the fact that there were so many statements. Do we just go off with just those statements on the study
So when
guide?
there's a statement like, if there's a statement, then you need to know that concept. That's the best way I could say it. So if there's a statement like social justice is blah, 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 or know the difference, then what that means is know the definition. And so if you know the definition, then when they say, which of these is social justice or which of these is advocacy, you can answer, right?
Yeah,
Does that make sense to you?
Yeah, I just wanted to just verify that because like I said before, we've had people who professors who give us study guides. We say, hey, look up at study guide, know the concept, which is cool. We go in the book, we do it. It's fine. I'm just verifying that the statements that are on here are just the statements we need to know, or do I need to go into the book and go a little bit deeper? That was my question.
I focus most on studying what we've gone over.
Cool, thank you.
Okay, but
Professor.
I'm not going to tell you that this is every single question and I went over every single question. Okay, I just have to put that out there. I went over most of the concepts that I want you to know. And like, we came up with questions ourselves, Danielle, right? Where we were like, oh, this would be select all that apply. So you see what I'm saying?
Yeah, I totally get that. Like I said,
Okay.
I was trying to go over the study guide on how to prepare, because I always like to write out my whole study guide. So
Sure.
that's
And
why.
I would rewrite your study guide. That's a wonderful study technique.
So
Rewriting
that's-
it.
I just
Or
wanted to
putting
be-
it on index cards. That's wonderful.
Yeah, I just wanted to be thorough with it when it came to statements. Just focus on the statement and don't go too depth into the book, because I read
Correct.
my book and everything. I just want to make sure. Thank you.
Yeah. I mean, I can't tell you, like I said, I can't tell you, but I'm trying to tell you without telling you, focus on the study guide. But of course, reading is very important. So hear me out. It's very important. But I mean, I would focus, you know, it's hard. I mean, there's a lot of concepts. We've only had 2 weeks of class. I mean, it's a lot, but this is going to be the whole semester because we have tons of stuff to cover. So that's how it works. It's just, you know, the more you get into the nursing program, the harder stuff gets. You know what I mean? All right, we're going to start. And this one you guys can play with me. You ready? Hold on. So go to Kahoot, KAHOOT.IT, and then you should be able to play with me. Okay, I'm going to give you a pin in a second. Okay. There's our pin. See it? 2953248. I only have 2 players. That's lame. Come on, join in. Nobody knows what you answer. It's a free for all. All right, only 3 of you want to do it with me? Okay, fine. I'll start. Which of the family must be established before beginning a family assessment? Most convenient time, rationale, best to interview, and why the data is needed. This goes back to our phases that we went over. All right, so we are going to, what phase was this? Does anybody remember?
The pre-visit phase.
That's pre-visit, and what else?
And
It's okay.
Initiation.
Yeah, the one before the pre.
Yeah, good. All right, so you're gonna see when's a good time to visit, why are we going, and what do we need? Request to meet a family in their home. Explain the rationale for this request. Family will feel better. Families typically welcome others in their home. The nurse can assess the family environment. More family members can be involved. All right. We got, I don't know how many we have playing anymore, but we got a lot of these were good. All right, so family feels more comfortable. Some people are not going to welcome you in their home. So if you call them and they say, no, I don't feel comfortable, maybe they're embarrassed. Maybe they haven't cleaned the house. Maybe there's someone there that they, you know, don't want you to see. Maybe their son is dealing drugs out of the basement. Right? Okay, good. Which of the following must be considered before deciding on a plan of action? The family agrees to the plan, family will learn better coping skills, are capable of the required actions, or the nurse has informed family how to complete the actions. Oof, we got mixed reviews on that one. All right, so why is it more important to, before deciding on a plan of care?
You gotta see if the family is up to taking care of whatever needs to be taken care of, like, are they physically capable of doing whatever needs to be done?
Right, remember, we're looking at what happens before the plan, right? So red would not be the right answer because the family agrees to the nurse's plan. We're not ready to implement the plan yet, right? We're just planning it because we're deciding what is our good one to do. Does that make sense for those who answered red? You don't have to answer me, but that would be our rationale there. Which statement best explains why family functions and structures create unique challenges in family nursing? And we talked about this. Function change over time. They don't apply to all families. They do not have families. And traditional families are rare in society. Remember what happens is that the fluctuation in family and the structures and who is going to take care of who and who's working on Tuesday and who will be home on Wednesday, things are going to change every time with the family and structures. Okay, so maybe for the first week you're with the patient, she's with her son, and then the next week she's with the daughter, and then back to the son and back to the daughter, because that's what they can do, right? So we want to be very sensitive that function and structure do not apply. Well, there is function and there is structure in every family. It's just not going to be the same. Okay, so that one is why we wouldn't pick yellow. RN is in the termination phase. What would they most likely implement? Remember, terminate. Very good. You guys almost all got it. We don't really do a formal evaluation. We will review the relationship, but that's not really going to help us to terminate when we're terminating this nurse-family relationship. Because, I mean, what if the relationship was not that good? What are we going to do about that at the termination phase? Not a whole lot. We're already terminating it, so that's not really going to be important. RN calls to arrange a first visit. What information should the nurse share with the family? That's in one of our phases as well. What are they sharing? That was in our, which phase was that? The reason for the visit?
Is the initiation?
Yes, and in the pre-visit phase, we're looking at the data as to why we're going as well. So I want you to think about that. Oh, lovely. Genomic healthcare. What are we worrying about? Remember, which of the following best describes? Okay, so I will tell you that when we look at genes, we can use it to detect for cancer, but is that our best choice? No. And this red is not, no, we're not going to understand family relationships from that. That's going to be more in our eco maps, right? It's not even going to be family relationships, but it's going to be how does the family interact with the environment. So red would definitely not be the answer. Useful in learning about environmental, remember E for E. So it's going to be our eco maps, and our best answer is going to be determining family health risks. Health risk appraisal. This kind of goes with the person who asked me the question about health disparities or something. All right, so health risk, what is our key there?
the unhealthy because it's a risk factor.
Mhm. It's a risk factor, having unhealthy habits. Okay, good. All right, I'm going to, I didn't get an answer on the Kahoot, but I'll do one more with you guys, okay? Oh, yes. During which phase of the home visit did the nurse document what was accomplished? Very good. It's the post-visit phase. That's when, after we're like done, right? After the visit. The in-home phase, we're not going to be documenting in the home. Because we need to go and evaluate, and we're not going to spend our time in the home setting, right? We're going to go in there, do what we got to do and get out. We're not going to sit there charting as we go along. Okay. All right, so does that kind of help with our questions and where we're going with the study guide? Okay. All right, so somebody put something in the chat, key points, sum up the chapter, something like that. Or also your green HESI book. The HESI book is really good. Somebody put that in the chat. So yes, it is.
If
Right.
you get permission from Professor Brown and Lundy, you're gonna post that Kahoot for us?
Yeah,
that
both
we
of
were
them.
doing?
Yeah.
Okay.
Both of them. And I will post this recording for us as well, but that, you know, I would listen to some major points in the review.
Will you be able to post the Kahoots for everyone or just the students in your class?
No, I can ask them if we can do it as an announcement.
I appreciate it.
Yeah, let me just make sure.
So your recording will be sent out to all of the other students outside of your class as well?
It should be. I will put my email in the chat if you did not get a copy of it.
Okay, thank you.
Send me an email and I'll send it.
Okay.
And I promise, guys, in my class, those have held on through thick and thin. Jen, I think you're it, but I'm going to post the lecture and the exam review, okay?
Thank you.
You're welcome. All right, guys, I wish you the best of luck. Prepare, don't get nervous. You know this stuff. We've gone over it. The study guide goes over it. You'll be fine. You're this far along.
Thank you so much.
You've made it this far. You're welcome. Have a nice weekend, everybody. Enjoy, study a little bit along the way. Listen to the recording, this recording in the car, and there should be one more tomorrow at 11 a.m. I will post that link for you guys if you want it. And if not, then
I do, if you can send it to me, or I'll email you and then you can send it to me.
will you do me a favor? Just send me a quick email, Ashley, so I have your
Yeah.
email and I'll respond to it.
Thank you.
Anybody else want a copy of that?
Yes, I do.
It's an
please.
announcement. I saw it.
It's in announcements. It should have popped up. I think they might have. I'll check my class's announcements and see if it's in there before we let go. Let me just look real quick. So usually what ends up happening is some things are posted as a community wide and some are posted individual. No, I don't see it. I'll post it for my class as an announcement, okay?
All right, thank you.
All right, guys, good luck. Best of luck studying. If you have any questions, feel free to contact me. I can always answer them, okay?
Thank you.
Good
Thank you
night.
for your time.
You're welcome. Good night.
Good night.